So this picture was sent in by Andrew, who lives in the Republic of Ireland, and it shows a bus. And it's great to see that the ventilation message does seem to be getting through in the Republic of Ireland. Some people might say, unlike other areas that could be mentioned. So I think the message is getting through. It's just frustratingly slow, isn't it? Welcome to this video, of course. Great to have you along. A bit of bringing up to date on things that have happened recently, and we're going to have a look at the United States at the moment, because of all the places in the world that we get free news from, and of course that's not everywhere, but where we get free news from, the biggest concern at the moment, in my mind, in this pandemic, is the hospitalization rates in the United States. It's becoming serious in many areas. So I want to be having a look at that. But before we start, let's just have a quick review. What's now being called the vaccine race. Now, an appalling term, but there you go. It's what we've got. And of course, the Pfizer and the Moderna vaccine are both being sold for profit. They're not making any mistakes about that. Oh, Winston's off shot, look. There we go. Don't want to upset him. He's been very good wearing his mask. I've told you about Winston before. People keep asking. He represents the black dog of depression, because we have to remember that it's not just bodies, it's minds, and people are holistic: mind, body, spirit. Anyway, sorry, back to the point. The Pfizer, BioNTech and the Moderna vaccines have both been sold for profit. Now, that's not wrong. But they are relatively expensive. And one of the things that are concerning me is, I just read an article today, and I'm hoping to get some definitive information on this, but it looks like quite a few people in poorer areas will not be getting vaccinated in 2021 or even 2022. Who knows, maybe not even 2023. So we're going to come back to that, but let's stick with where we are at the moment. So the Pfizer Moderna vaccine, the mRNA, messenger ribonucleic acid vaccine, 2 doses. Now, in quite a few countries, the military and are involved. The United States and the United Kingdom, the military are involved in distribution, because basically logistics is getting the right stuff to the right people in the right place at the right time, and that's what they do. They're good at that. So let's let them get on with it. I think that's brilliant. Now, 7 a.m. Monday is like the first official time someone's going to be vaccinated in the UK with the Pfizer BioNTech vaccine. But I've got a hunch there might be some on Saturday or Sunday, so it could be even quicker than that. Potentially even sooner, potentially even Friday. So anyway, it's going to be soon, and that rollout is going to start then. That looks like the latest time it's going to start, but that seems to be the official time. Now, I've just been looking at some of the data and some of the people talking who had this vaccine in the trial. Now, in the clinical trial, of course, and of course the only people that have had the vaccine so far are in the trial. In the trial, you don't know whether you're in the experimental group who gets the vaccine or the placebo group. This is a blind trial. In fact, it's a double-blind trial. The people giving the injections don't know. It's all just coded and is later decoded. But of course, if you have the injection, what will happen is this RNA will get into your cells. Some of the muscle cells in your arm, it will get into there. Those muscle cells will express the SARS coronavirus 2 spike protein antigen. It will also go into your lymph nodes and be expressed by specialised cells called antigen-presenting cells. But the point is, in your arm, there'll be a foreign protein being produced by your own body cells. And the immune system will recognise that protein has been foreign and mount an immunological response. But there's also an inflammatory response as well, which of course is exactly what we want. We want this response. But the inflammatory response gives you an achy arm. So basically, people that were given a shot of saline, they didn't get an achy arm. And it's not the injection, it's not the sticking the needle in that causes the achy arm. That's a very minor, very small needle. It is the inflammatory reaction that causes the sore arm. So people actually knew when they were getting it, which is a bit of a problem really, because there's always the possibility of placebo effects there. But we're not going to go into that now. But the point is, people knew when they were getting it, And they're saying that for a day or two after, they felt a bit ropey. So one guy described it as a really bad hangover, as if he'd been out on the tiles all night. Headache and fatigue seem to be the main factors, headache and fatigue. But they are short-lived. And that is just the body's immune system reacting as if you had the infection, really. But of course, you haven't got the infection. You've only got the protein from the spike protein. But that simulates the infection, but it doesn't give you the infection because there's no SARS coronavirus 2 viruses to give you the infection. So a price well worth paying, in my view, to feel a bit ropey for a couple of days, but not to be underestimated. And this has got implications for workforces. So, when I worked on A&E, the Yockey health nurses had come round, and you could be sitting there doing a job on your computer, and they'd come up and stick the flu vac in your arm, do the whole department in one visit. Well, anyone who was on shift. But if you did that with this vaccine, it may be that everyone was too tired to come to work the following day. So it may be necessary to stage the way people are vaccinated, because the day after they might need to spend the day in bed. Having said that, we don't know that yet. This is based on individual accounts. We'll have to find out. But it's normal. Vaccines can make you feel a bit sore and a bit not right for a couple of days. So that's nothing to worry about. It doesn't concern me at all. But it's just something to be aware of. Second shot, that this particular person I saw the interview with didn't feel so bad. So there you go. It'll be different for everyone. Right, up next. Moderna's up next. This is going to be the next one to get approval. Another messenger RNA vaccine. 2 doses also required. Slightly more expensive than the Pfizer, I believe. Then the Oxford AstraZeneca Chimp Adeno virus, vector virus, also requiring 2 doses, should be up after that. And then my money up for the one after that is the Johnson & Johnson. The Adenovirus, another Adenovirus one. Now, this is interesting. Johnson & Johnson, they originally started off doing a trial with a single dose, which would be great. Single dose rather than 2-dose vaccine, but they're now also trialling a 2-dose vaccine as well. So what they're going to end up with, we don't yet know. It could be 1 dose, it could be 2 doses. Now, Jonathan Van-Tam is our Deputy Chief Medical Officer, Professor Van-Tam, and yesterday in the news conference with the Prime Minister, he said COVID's going to be here forever. In other words, he seemed to be saying it's going to become endemic. As with the 4 types of coronavirus that cause the common cold that are always alive in someone and just keep circulating. Now, is he right about that? Well, I don't think so, actually. Now, he's the Deputy Chief Medical Officer. He's got better opinions than me. But not better opinions, but he's got better informers. He's talking to the people directly, the boffins and experts directly. But to me, for it to become endemic means it would always have to be alive in someone, and the virus would have to spread all the time. Or some people would have to be carriers, that they carried the virus for long periods of time, shed the virus and infected other people. Or the virus would have to get into an animal reservoir, such as otters or mink or things like that, where we know there's a problem. And people could be zoonotically reinfected. So I think, my hunch is being unduly pessimistic. It's more than a hunch. Because SARS coronavirus 1 no longer exists. It's gone. It's been eradicated. And this is very similar. The most biochemically similar virus to the SARS coronavirus 2 we have now is the SARS coronavirus 1 that caused the 2003 pandemic, and that's gone. And we don't get epidemics or pandemics of Middle East respiratory syndrome anymore either. Now, this virus it is a reservoir in camels, so we get reinfection from camels, but very small amounts. So I still feel that with vaccine and with good public health measures, we can eradicate SARS coronavirus 2. Who's right? We're not going to know for some period of time. Now, the next heading I wanted to talk about is European Medicines Agency. Apparently a meeting on the 29th of December to discuss the Pfizer BioNTech vaccine. Now, this vaccine is being produced in Belgium, and some production is going to start kicking off in Germany as far as we know, but Belgium, they're producing huge amounts of this. But the European Medicines Agency doesn't seem to be meeting till the 29th of December. Now, what is going on here? Why are they taking so long? It seems that they're having to go around and talk to all 27 member states in the EU to get everyone on board so they can have a meeting on the 29th of December and then say, OK, start vaccinating now then. But even after the European Medicines Agency, I think they meet in Amsterdam. It is Amsterdam, yeah. If they say, yes, this is great, go, then the individual member states, all 27 of them, will have to have national authorization for this as well. This means that the Pfizer BioNTech vaccine, despite being produced in Belgium, and despite by this time it'll have been used in the UK for, well, a whole month really, but more than 4 weeks, it won't be getting used in the European Union until the new year. Now, does this mean the UK authorities have done a sloppy job? Well, it doesn't, because they were, when the application was put in on the 23rd of November, the European, the British Medicines Agency, that they hadn't been sitting there doing nothing. They were completely up to speed with it, so they hit the ground running. They'd been following the developments right from the start. So this really is a bit of an indictment on this bureaucratic process that basically is delaying the onset of the vaccination programme in all of Europe for 5 weeks. The reason the UK can do it is the UK at the moment is still bound by European legislation. But we have an exemption. I think it's European Regulation 174 from memory. So we can go it on our own, even though we are technically, legally at the moment, still a member state. So I'm not making any pro-Brexit comment, anti-Brexit comment, nothing like that. The simple fact of the matter is delayed by 5 weeks, and I think it's quite inexplicable that they are delaying for 5 weeks. But there you go. The American Pfizer announcement, as far as I know, is the 10th of December, and the Moderna one is the 17th of December. And I'm just wondering how much the British regulatory authorities are being consulted by their overseas counterparts to get this going a bit, because 5 weeks, basically, this is the critical time. This is winter time. This is when we really, really need to start doing this. There's a lot of people can die in 5 weeks, and a lot more billions of euros can be wasted in 5 weeks. So that is just some thinking on that. Now, going on to the main concern for today, which is the United States. The real number we know now is probably 100 million. Give or take 5 million, I would say it's 100 million infections in the United States. Midwest, still quite a lot of growth. I think Minnesota was top of the league today. You can look down on this and get all the figures. Yeah, Minnesota was top there. And also concerning the deaths in the States are rising. So if we can go on to trends, I think this is just incomplete data here. I don't think the numbers are going down. It's still going up. And if we go on to deaths, we see that deaths are increasing. Now, obviously, the way these are reported, you get disproportionately high numbers some days, disproportionately low numbers other days. The red line is the trend, and again, I think that's probably artifactual. The trend, unfortunately, is increasing in the United States. So that is a concern, and of course, why this really matters, and the main focus of my concern is this graph here, which is the hospitalizations. So here we see the hospitalizations in the first wave. Here we see the hospitalizations in the second wave. Now, with hospitalizations, we know this is genuine data. Now, when we show the number of cases, and you kind of get a low number in March, April time, and a way higher number now, that's largely artifactual, because we were greatly underreporting cases in the first wave, whereas now the number of cases is being better reported, if not completely reported. Remember, the CDC still think they're only getting about 1 in 7, 1 in 8 cases. Most are still going undiagnosed. But with hospitalizations, we know that's real data. And this downward trend, of course, is always artifactual. So that takes us up to the week ending the 14th of November. So that's still quite out of date, and there's no two ways around it. That's quite a significant increase in hospitalizations in the States. So check on that for yourself. There's the links, which I always post in the description, of course. Now, Transport Security Administration, there's the link for that in the States. 25th to 29th of November, air passengers, 4.6 million went through security in US airports. Okay, it's massively down from last year, but it's still a lot because we're in the grip of a raging pandemic now. This is now in the next couple of months is the key time. This is absolutely raging at the moment, and it's only going up. And yet 4.6 million people decided to fly around for Thanksgiving. Still busiest travel time since mid-March, despite lower numbers than last year. Now, apparently, this is just the Washington Post that I've got this from. Crowd Chicago, O'Hare and Phoenix Sky Harbor. I think I should say tight. I'm not sure. Anyway, tight. It means quite packed security lines, tight security lines. Now, obviously, mask wearing would be good, but I don't know what the ventilation was like. That's the key thing we don't know, the ventilation. The ventilation is absolutely vital. If you have a fairly packed line, or queued would say in this country, you've got good ventilation, it's not so bad. If your ventilation's not good, then it's not a good situation. Those who travelled during the holiday, they got tested 100% mask wearing, avoid crowds. So that was the advice, but this was the thing that didn't always happen. Now, the reason I'm talking about this now is Thanksgiving has passed, and we are going to see more cases as a result of that. But what is coming up, of course, is Christmas and New Year. And basically, in my country, the government have greatly liberalised what you're allowed to do for Christmas and New Year. Whereas my position is we should skip Christmas and New Year this time. So I'm going to show you some things, I think, from Salt Lake Health Department, which are probably very helpful. Here is the first one. Smile, I've just been exposed to COVID. So here we see that this person, one of these people here, infected for 9 days, no symptoms and feeling great, has infected 24 people so far. So quite a sobering message there from health education authorities in Salt Lake. And there's another one here which is probably even more powerful actually. It shows a family group at Thanksgiving, but of course what I'm worried about now is Christmas and New Year because yeah. Right, so this chap here, infected for 9 days, no symptoms, feeling great, has infected 24 people so far. Mother's at risk because she has cancer. This chap infected for 45 minutes. So he's been infected for the last 45 minutes. In 5 days he'll get really sick, miss work and miss 2 paychecks. Has a baby on the way, which of course is a concern. Has asthma. And this is particularly important because we know people with asthma are more prone to developing long COVID. At least early data from the UK indicates they're more at risk from long COVID. And I know these are just actors that are kind of set up for this scene, but this relative here, high risk, will die from COVID complications. I mean, wow. So, you know, that is, you know, to think that this young woman here could die because of this, as this guy here feels great. You know, it's a health education message, as I say. It's staged, but to me, it just gets the message. I find that a really powerful message. Anyway, so Salt Lake. This is, I think this is their Twitter feed. I think I cut and pasted that from. What I'm saying is, okay, it's only early December, but we can't have a normal Christmas and New Year. Next year we can, but this year we can't. That poster tells you why not. And Salt Lake also said this again, pretty hard hitting. They probably won't, the leftovers probably won't taste of anything at all. Yep. So that was Salt Lake, and let's take that message on board. Now, hospitals are filling up in the States, as we've seen. My main concern at the moment, really, getting on for 100,000 hospitalised. 25% increase in the past week in Arizona, California, Maine, New Hampshire, Pennsylvania, West Virginia. All increased by 25% hospitalizations in the past week. This is not sustainable. And yet, because we know about the lag effect that we've done many times, we showed the graph the other day, there are going to be more people trying to get into hospital in the next weeks. And yet we're already very, very strained. Chief Healthcare Officer Association of American Medical Colleges. If the number of hospitalizations keep rising, hospitals may be forced to offer less care to those with numerous comorbidities in favour of treating others with a better chance of survival. For someone in this position to be talking in these terms is sobering. Basically, it means some people won't be, potentially. Let's hope it doesn't come to this. But potentially some people who are very sick won't be treated. That's potentially what this means. This is stark language for people in these positions to be using. Crisis standards of care may be needed in hospitals at the same time, because many different hospitals are filling up all at the same time. So just a few examples from the popular press. New York State Department of Health. Emergency hospital measures, an anticipated surge of admissions in the coming weeks, so they're expecting more patients in New York. Preparing to increase bed capacity by 50%. But can you increase staffing capacity? Because you remember in the first wave, people from all over the United States came to work in New York, which was badly affected, of course. But that was when other parts of the United States weren't so badly affected. If they're needed at home, it's going to be much more difficult for them to travel to New York, because this is happening on a much broader front, is the issue at the moment. California, state intensive care is already 2/3 full. Gavin Newsom. Again, worrying sign. It could reach 112% capacity by mid-December. I don't know how you reach 112% capacity. You just have to have intensive care facilities in other places, such as anaesthetic rooms. Ohio, hospitalizations up 200% since the 1st of November. So I think that's enough to say why that is a concern. And of course, what we have to do is get the number of cases down, so the hospitalizations go down, so that the number of deaths and hospitalizations go down. Now, immunisations in the States, they are starting. They're not going to make a big difference this year. Here, this is quite interesting. Centre for Disease Control instructs states to be ready for distribution by the 15th of December. So good. Can't come soon enough. First doses. Now, this committee has decided to prioritise healthcare workers and residents and staff of care facilities. And it's worth remembering that long-term care facilities, 6% of cases, 39% of deaths. So this will save most lives most quickly. And also, if we can stop the most vulnerable people from getting sick, that is the quickest way to reduce pressure on healthcare facilities. So the quickest way to reduce pressure on hospitals is to vaccinate the most vulnerable so that they don't get sick enough to be hospitalised. And all the vaccine trials so far, the Pfizer, the Moderna, the Oxford AstraZeneca, they've all shown that COVID is basically, not COVID, the vaccines, all those 3 vaccines, are basically 100% effective at preventing severe COVID. Now, when we roll this out to larger numbers, it won't be like that. But we know that these are going to not only prevent people from getting COVID in the first place. If they do get it, it looks like it stops them getting severe COVID, and that's going to stop them getting hospitalised. So vaccinating the most at risk, of course, is the most logical thing to do. Non-essential workers and older adults next. Pfizer, BioNTech, Moderna, together with Pfizer, BioNTech vaccine and the Moderna National Institutes of Health vaccine, 40 million doses in 2020. They are geared up and ready to go. A lot of the manufacturing has already been done. Then they're going to bash out 5 to 10 million doses per week after that. Pfizer has got 6.4 million doses to go in the first 24 hours. As we said, you might need to stagger workforce in vaccinations because of the potential side effects. And I don't think a lot of people have really got this point. So if you've got a critical workforce, I think you need to vaccinate them in stages because and just see how these side effects go. Hopefully they'll be minimal, but basically we don't yet know. Now, I did mention I'm concerned about vaccination in many poorer parts of the world. That doesn't seem to be. Well, there are plans. We'll talk about it later. There's the WHO program for that, but how effective that's going to be, we don't yet know. We do know that China and the UK are involved. We do know that the US and Russia are not involved at the moment. So moving on to the Russian vaccine briefly before we finish today. Am I on? Yep, that's it. Mass voluntary vaccination starting next week. Good. Well, we think it's good. Phase 3 trials have been announced in Russia. 16,000 volunteers. The Sputnik vaccine, 92% efficacy is being quoted. They're saying there's no unexpected adverse events, which sounds good. This is not peer-reviewed yet, of course, but there again, to be fair, none of the vaccine data is peer-reviewed yet. The Pfizer data is not peer-reviewed yet, the Moderna data is not peer-reviewed yet. It's going through the regulatory authorities first, before the published papers are peer-reviewed, which we look forward to, of course. And World Health Organization is in talks with Russia for emergency use listing. So that would be good. At least that would put it on some sort of official international recognition, which would be good. Okay, I think that'll probably do us for now. Maybe we'll just look at a couple of examples of your experience of the pandemic. Now, these are from Dylan in Dubai. So, don't know the lady's name, sorry, but Dylan in Dubai. There's that posh hotel in the background there, shaped like a sail. Public health information, which looks good. For your safety, please wear face masks. I guess that's what that says. Public health information, yes, we can defeat COVID-19. So that's the experience of Dylan in Dubai, and maybe we'll show one more. This is Stephen in Toronto. Just a couple of pictures from Stephen in Toronto. Okay. Not quite sure what this is, but they're wearing a mask, which is good. Looks like a thank you from frontline care staff. Okay. And I'm masking you. Okay, fair enough. Okay, so that's from Stephen in Toronto. So that'll do for today, I think. I was going to talk more about the vaccines, but we've gone on for long enough today, so we'll probably leave that for now. I know I haven't given you the detailed breakdown on the use of the trial on the Moderna vaccine yet, but we'll do that. And the Johnson & Johnson vaccine looks like it might be the next one up, and still hoping that's going to be a single dose, which would make logistics a lot more convenient. Okay, I'm going to put the link for the ebooks again below. Do download those if you haven't done so already. And happy reading, and thank you for watching as always.